markers, the targeted therapy, but I have chosen to show you something about some studies which go back to very simple principles and might be changing our daily practice and could be applied all over the world. So one of the interesting studies I watched was the CEA study. It's Dutch Dutch group is looking back into the value of CEA during follow-up of colorectal cancer. And as you can see, the study included patients with colorectal cancer stage 1 to 3, patients that were fit for metastastectomy, because the idea after the study was to find patients earlier on during the development of metastatic disease. 11 hospitals participated in the study, and the intervention was to increase the follow-up with CEA every 8 weeks. And the other, of course, control group would be followed up according to the Dutch guidelines. Well, the trial design was also very interesting because it's very difficult to have patients on different follow-up schemes. So what they decided to do is to start all the hospitals, and then one by one, the hospitals would cross over. They all would start with the usual follow-up, then one hospital would start doing the experimental follow-up, and so on, and so on. And then in the end you get something like this, that every hospital has changed to intervention group. And this is a very interesting approach which could be used, of course, in more follow-up studies. As you can see, many patients were included, and they were really quite balanced. So, and what were the results? They were very interesting in the intensified follow-up. More recurrences were detected, but what was even more important is that many of these early recurrences that were detected also were curable. So this was a very significant finding. Of course, we have some problems with this study. If you early detect metastasis, will this really lead to more cure of the patients? And follow-up of this group of patients is still too short to be very conclusive about that. So, but early detection is indeed the first step to cure all patients with metastasis. And the second one is, of course, we also have to do the final analysis regarding the cost of this intensified follow-up, because CEA follow-up is a very cheap method, but we also have the false positives, patients who also would be staged for having recurrent disease, but they don't have any recurrent disease, so we don't know about that yet. But it's a very interesting approach that good old CEA can be change our daily practice. Then there was another very interesting trial. It was a negative